Hello, everyone, and welcome to the peer assessment, the virtual peer assessment information webinar. My name is Alex Carling, and I am the Director of Professional Practice and Quality Assurance here at the college, and I'm thrilled to introduce my colleague, Sarah.
Hello, everybody. Thank you for joining us today. I'm Sarah Chapman-Jay, and I'm practice advisor. I'm a speech language pathologist, and I've also been a peer assessor. So between all of those, and I've been peer assessed. So hopefully between us, we'll be able to help address your questions and share information with you.
Absolutely. Thank you, Sarah. And talking of questions, you will see a questions box. Please feel free to just write your questions as we go along. I'm going to do the first part of the presentation and Sarah will monitor questions, and then Sarah will take over halfway through and I will monitor your questions. So let's get going. So first of all, I'm going to start sharing my screen. And you will see here, we are on the CastlePo webpage. And I'm going to show you how to get to the quality assurance pages. So you just click on registrants. And then on the left-hand side, you'll see quality assurance program. And then click on the right box that says peer assessment program. And here you will see some documents, and we are going to be posting either this recording or last Thursday's recording to this web page, so you will be able to re-review the information at any time. So let's go into the peer assessment guide, and here we are, and we are going to look at all of the information together. But just actually before I do that, I am going to do one other thing, and that is just hop on to the self-assessment tool. So we do have a test site. And so let's sign in. And the reason why I've gone on to the self-assessment tool is the first thing we're going to talk about is the practice description. Please just quickly review it, check everything is good, and it really does represent you. And the reason why we're asking you to do this is that literally maybe starting next week, we are going to start matching you with the peer assessors, and we use your practice description to match as accurately as we can. So going through this, you will see a box at the bottom, and if you feel there's any additional information that you'd like to add that you will think is helpful to the matching process, please just put it in here. Excellent. So now we're going back to the guide, and we are going to focus this section of the presentation on evidence and uploading evidence to your clinical reasoning tool. So I am going to start by actually going to the end of the guide and going to the appendix. And here you will see the different types of evidence that are required. Now, we're asking that the evidence come from at least 5 different patient records. Please, that does not mean that you are uploading 5 pieces of information for every indicator. What it does mean that because we're trialing the new virtual system and we're not doing a site visit, so we can't do a records review. So the evidence that you're uploading, you know, it sort of increases in significance, and we want to make sure that it represents at least 5 of your records, okay? So we can go through the indicators. It's just one piece of evidence per indicator. Now, you'll see here in a column called additional evidence that very occasionally, actually only twice, we're asking you for two pieces of evidence, and that the evidence be quite different. So first of all, for the audiologists joining today, 1.3 about performing the controlled act of prescribing a hearing aid, we would like two pieces of evidence from different phases of the hearing aid prescription. Literally, it could start with consent, or your audiometric testing, or your prescription, or your validation and verification. Okay? And again, I'm going to show you 1.5, and this is both for SLPs and audiologists if you supervise support personnel, a CDA, a rehab assistant, an SLP assistant, etc. And again, we're asking for two pieces of evidence showing very different aspects of supervision, starting from consent, showing how you supervise, etc. So as we progress, what I am quickly going to do is come out of my email so I get no new messages. All right, so now you can see here in green that most of the evidence will be coming from one of 5 patient records. However, sometimes we know that the evidence won't be found in a patient record. So let's have a look here. I ensure that all materials, equipment, including assessment and therapy materials in my practice are current, in proper working order, and calibrated as required. So actually what we are asking for this one is a live or recorded review of equipment and materials. So this can be a very short film, can be live on the day of your virtual visit, or it could be some photographs. So for the audiologist, maybe showing your soundproof room, your audiometric equipment. For SLPs, it could be gathering together some of your materials and assessments, laying them out on a table maybe, and taking a photograph. So we've got photographic evidence that your equipment is up to date, in good working order, and is calibrated. Now, there are a couple of others where we're going to ask for this live or recorded evidence. So for example, I've put IPAC here, please forgive me, it's infection, prevention and control. So your IPAC practices to show you're meeting the standard 1.7. Again, it could be a variety from some of your PPE, maybe even a photograph of you in your PPE or your PPE on a table, or your equipment to clean your area. Now, some of you have been asking us saying, well, I'm doing nothing but virtual at the moment, but you still do have to clean your virtual equipment. So, you know, either that or some policies as well. So I'm going to scroll down. Maintaining patient confidentiality is another area. We're looking for recorded review of how you keep your records secure. And I think that's it. You will also see here behavior-based questions, and Sarah will be going into those in some detail. So sometimes we'll ask for a very specific piece of information. So if you have been delegated a controlled act, we would want a copy of that medical directive. Now, I'm fortunate enough to have 2 screens, so I'm just going to look over to the screen on the right-hand side and make sure that I am covering everything. Okay, so when we're talking about a patient record, sometimes you might be using forms. For example, case history forms, screening forms, assessment forms, consent forms. Make sure that you upload one where you have filled it in. It's an authentic form filled in and part of the patient record. So we are asking for, it is better to have current case information, patient information, or recently discharged patient information, because if your peer assessor wants to have a conversation about it, it's nice and fresh in your mind. However, if you know of a case that you discharged maybe 2 years ago, but it is an absolutely ideal piece of evidence to upload to show that you are meeting the standards, then you can use that. So the evidence we say is 3 years old. So that would be 2020, 2019, and 2018. Okay. Now, sometimes you're uploading, we're giving you until March the 6th. If that's a bit tight for you, contact me and we can discuss a bit of an extension. However, you might in April have a new referral and the evidence is a much better example of you meeting that standard. You can change it up. You can go into your SAT, and we'll have a look at that in a moment, upload the evidence and either keep it as a second piece or delete your first example. Now, many of you might be working at either different sites for the same company, different schools for the school board, or 2 different companies. So you are going to decide where you're going to have your virtual interview. And I would choose, if you have some ability to choose, the place where you've got most access to your patient records. And if you are going to use a record from another site as evidence of meeting the standards, we really do recommend that you have access to that record. Okay, so you've got your 5 records or more. You don't have to stop at 5. You've got your 5 records or more, and really make sure that you are familiar with them. Okay, so let us look at the logistics of uploading. Okay, so I'm first of all going to go to page 11. So here we have some information on how you can convert a paper record or a computer record into evidence to upload to your self-assessment tool. Not forgetting that the self-assessment tool is extremely secure. It has military-grade security, and the information is stored in Canada. So that's good news. So you can scan documents, you can take pictures with a camera, and then there are apps now for your camera where you can convert it into a PDF and upload. You can take a screenshot, or you can use a snip tool. So any which way of these different methods, you can get them either to your desktop and upload, or you can upload straight to your SAT. When you have done that and they are uploaded, just pop back in again and make sure that it's been uploaded successfully, that it's not upside down and things like that. All right. Then when you've done that and you're comfortable with everything you've uploaded, please delete any patient information from your phone, from your desktop, etc. Okay. Now, some people have said, do you have to redact information? That is black it out. And we're going to say that is up to you, because under PHIPA, the Personal Health Information and Protection Act, and under the RHPA, the Regulated Health Professions Act, you are allowed to give us access to your patient records for the purposes of regulation without getting consent from your patients. So you do not have to get consent. You can upload for the purposes of peer assessment. You do not have to redact. However, if your place of work is more comfortable with you redacting, or if indeed you yourself are more comfortable with redacting, blacking out before you upload, please do so. If your place of work has any problems with uploading patient information to the self-assessment tool, please just give them my name and information number. I talk to the health records departments, to managers and administrators every single year. If they have concerns about the security, Claymore, that's the company that runs the self-assessment tool, they have the information on all of the confidentiality specs. I don't understand it. I don't think you would understand it, but certainly your health records and your IT company departments would understand it. Okay, so I am looking at my list. Now, we did send you some tips from the peer assessors. I think that was last Monday, so a week ago, on you know, the whole process, but a lot of it was on evidence. So definitely have a look at those. So now, one last thing before I go to Sarah to see if we have questions. We have asked you to take the evidence from at least 5 different patient records. So how is the peer assessor going to know that? So what we're going to ask you to do is just put something in front of the document name, like PR1 for patient record 1, PR3. So you can see here we have some examples. PR1 discharge criteria, PR3 consent to services, PR4 consent to PHIPA, etc. Okay, so before I hand over to Sarah, let's look how you do upload the evidence. So I'm going to my self-assessment tool. I'm going to practice standards, and let's get going. I'm going to select required for peer assessment, upload your evidence, and you'll come across this box. This is all in the guide, by the way, but we might as well show you as well. Choose a file. So I'm actually on my desktop, and let's go to Dentonia Park Book Club. So I'm going to upload that. And there it is. So I'm going to press upload, and there it is, Dentonia Park Book Club. So I'm going to have a quick look. There it is. And I'm seeing it on my other screen, but I can tell you it is not upside down. So that is good. But then I'm thinking a little bit later, I've got better evidence. So I'm going to get rid of this. And so let's just press this. There we are. Are you sure you want to delete the file? And press OK. So don't forget, there are some examples all the time about meeting the standards. So I'm actually going to go on to clinical practice here. This is a very important indicator. I develop and maintain a professional network for seeking feedback and sharing guidance. And you might be thinking, oh, what sort of evidence can I put for that? So go into the examples for meeting the standard, just that little box. And here you will have some examples. So Sarah, I am going to stop sharing my screen for a moment, come back to you and ask, are there any questions?
Yes, Alex, questions are coming in. I am trying to answer you privately with your questions, but it's also helpful that we say them out loud too, and we won't be able to catch them all. So here's one of the questions. When the chart says live or recorded, you're also mentioning photographs, even if this is not in the chart. Therefore, would photographs of equipment, storage of files, sanitation equipment, etc., be satisfactory?
Yes, thank you, Sarah. And thank you for the question. Yes, photographs would. Sarah and I were preparing for this information webinar and we were talking about this. And yes, photographs would be fine as well. So it can be a short film clip that you record if you just want to show your office. I'm thinking especially for audiologists or someone in voice showing some of the voice equipment. Or otherwise photographs. Yes.
Okay. And
And
yes, sorry, Alex. Ready for another question?
absolutely.
Yes. Okay, for indicator 1.2, I maintain records which accurately reflect the services provided. They want to know, would it be suitable to fill out the checklist for chart review for 5 charts as evidence and have the records on hand for review?
Okay, so the Sarah, we might have to sort of chat our
Yeah,
way through
I
this.
know, that's good. Yes.
Yeah, which is absolutely excellent. So I am going to quickly share my screen with you again, everyone, and show you here that we've got checklists for records reviews. So let's go into that so you can see it. And this is really excellent to make sure that your charts are complete, etc. When we were doing site visits, the peer assessor would go through all of these elements. Some of them won't apply, but have a good look at all of this. We are not asking, and I want to make this quite clear, we are not asking you to upload a complete record. No. We are asking you to upload just the evidence that shows that you meet that particular standard. So, Sarah, I am leaning a little bit towards maybe not using this. What do you think, Sarah?
So I agree, actually, Alex. I would say that this checklist is very useful for you to check
Yes.
that you have all the components that we expect from the records regulation in your records. So it, you know, just as she was demonstrating, you know, it's about consent, any previous reports, or, you know, and references. So that's all good. But what the peer assessor really wants to see is what your record looks like, or a
Yes.
component of your record.
Yeah.
So the checklist, I would say, is for your own review and you checking that you've got what you should have in the records. But the peer assessor really needs to see how you document. And that chart review checklist won't show that. It will just show check, check, check. So
Yeah.
no, ideally, I think we'd like to see, say, you know, how you obtain consent, all the different areas.
Yes.
Yeah.
And you know, you can choose something representative for 1.2 and records, you know. What you put in the records is 1.2 indicator is really sort of up to you.
That one's pretty open. Just want
Yeah.
to see what your records look like, and
Yeah.
you know, pick something that is very representative of how your records are
Yeah.
kept. Yeah.
Yeah.
A question, Alex, about the assigning each patient client a number and upload that way. For example, Johnny is PR1, so every excerpt from Johnny's file starts with PR1. If I use Sally's file for some other indicators, I name each of those PR2. Yes, so each patient record, yeah, so PR1, anything that's from Johnny's is going to be PR1, Sally's PR2.
Yes.
I will just make a comment here, because I know that some people have already loaded their evidence, and it is very difficult to rename the evidence once it's uploaded. You know, the time you can name it is before you upload it. So one suggestion I did make, because somebody had uploaded all their evidence, was in the comments box, maybe what they had done instead of given initials. So say Sally was SC. So maybe just in the comment box, put down PR2 equals SC, something like that.
Excellent idea.
Would that be
Sarah.
okay?
Excellent.
Yeah.
Yeah. And also, Sarah, that's a good point about the comments box. Do feel free to use the comments box if you want to add some, you know, extra information. You know, you can. Don't feel obliged to, but if you want to sort of think, if you think, this piece of evidence really does show I meet the standard, but I'd quite like to just add a sentence or two about background, do so. But if it's obvious, you needn't. Okay, Sarah, shall I go on with the learning goals?
If you wish, there are more questions, but in interest of time, absolutely, yes.
Okay, so tell you what, this next section, guys, is quite short. So let me just finish up, and then Sarah, I'll come back to questions.
Okay.
So here we are, and we're going to look at learning goals and clacks. So what the peer assessor is going to do, and Sarah will talk about this a little bit more, is just go in to previous years. So I'll let her talk about that. But what I am going to say is for 2021 is if you do have any clacks, put them in. Wouldn't you agree, Sarah? I mean, it's a good conversation to have. But really, what I'm going to go back into 2020, part of that conversation is, let's have a look here, about progress to meeting goal and impact on practice. So make sure you've put those in as well. Excellent. So the required document is to discuss is the standards for virtual care in Ontario. And if we go into accountability here, you can see it is there. Now, I do want to just say something about this accountability. We are not, and the peer assessor is not expecting you to have checked every single document and that you've read every document. That is not the purpose of this standard. Let's read just here. As a regulated health professional, you are required to be aware of the CASLPO documents. Some documents need to be reviewed in detail according to your area of practice. Please consider those you have reviewed during the past year. So obviously you are going to check off the virtual care standards, but you know, you might have only just reviewed maybe 2 or 3 other standards or position statements or guides or what have you. That is fine. But you will choose another document to review and discuss with your peer assessor. And it's really about how the standards and the other document pertain to you and your area of practice. So my last section, I started off with the practice description, and I'm going to end with the matching process. So you are going to be hearing in around about April, or actually no, even March, Sarah, we might be able to get this out in March. You are going to be hearing who is your peer assessor, and it will give you information about their name and about their area of practice. Now, under the quality assurance regulation, you have the opportunity to veto that peer assessor. This happens about once a year. I can give you some examples. One year we had a massive amount of people randomly selected from school boards. So we did have a peer assessor who did school health rehabilitation services. And we partnered her with someone, and that registrant said, no, can I please have a school board peer assessor? So that's one example Another example, it could be you knew them from the past, maybe you trained together, and even though you haven't been in contact, you would prefer a peer assessor maybe who you don't know. So anyway, we match them. You can veto. We never let the peer assessors know that they've been vetoed. It's completely confidential, and that you will be then allocated a second peer assessor, and they will never know that they are the second choice. So, Sarah, my section is done. Do you want me to spend a minute or two with some other questions, or?
I think so, yes.
Excellent.
Okay, so this person works in an acute care hospital, and they use an electronic documentation system, and so they're completely paperless. So should they notify the privacy office in advance, as they are not permitted to access any record that is not in their current circle of care?
Right.
So that's the first question. Yes.
Yes. Yeah. I don't think that does any harm of notifying your manager, notifying the privacy officer. I am going to share my screen with you because there is a useful document that I want to share with you. So let's go back into the quality assurance program and the peer assessment. And can you see here information for employers? If you click on that and scroll to the bottom, you will see the legislative authority for peer assessment. And here you can actually give this to your privacy officer if you want. Bearing in mind, actually, this might be of interest to you, all regulated health professionals have to undergo peer assessment. So a large hospital will be very used to this process because physicians, nurses, physiotherapists, occupational therapists, dietitians, social workers, pharmacists, all, and what are the other regulated health
medical radiation technologists? Yes, there's plenty.
The lab as well, they all have peer assessment processes. So they're going to be quite familiar. But here is the information on the legislation that allows us, for the purposes of regulation, of course, peer assessment, to have access to your records. So there it is.
Okay, and on the same theme, Alex, a question was, when we upload our evidence from the client's file, is it okay to keep personal information in, name, address, etc., that they don't need to redact information or cross out the last name?
You can keep it in. The legislation allows you. It is not a breach of confidentiality to have a name or address in it. It is very secure, military grade in Canada. However, if you're not comfortable with it, you can redact, but we'll leave it up to you. It is safe, it is secure, it is allowed.
Okay. And regarding clacks, can an audiobook or a podcast count towards clack hours? Absolutely. There are many in the field. Yeah, good.
Absolutely. Yeah. Yes, as long as they relate to your goal. Yes, absolutely.
Nice. And one more maybe. What happens when some of the examples of evidence on the SAT are not from patient records, but the chart says the evidence needs to be a patient record? For the peer assessment, does this mean we cannot use those non-client record evidence examples?
Okay, so I am going to go back to here. So let us have a look. So I am going to show one here. 1.8, I am knowledgeable about mandatory reports. Now, if you have made a mandatory report, you will have a patient record and you can use that patient record, okay? A mandatory report is regrettably for when you have seen another regulated health professional sexually abuse a patient or family member. It can be in the form of language, it doesn't have to be a physical action, or whether you suspect a child has been neglected or abused emotionally, physically, or sexually. So if you have not had any experience in this, then you are going to upload the policy, or any other information that you have. The same would go for conflict of interest. Neither of these would you ever sort of mark as not applicable, because the question is, or the statement is, I am knowledgeable about mandatory reports. Doesn't matter where you work, you have to be knowledgeable. And you have to be knowledgeable about conflict of interest. And even if you work for a publicly funded environment, such as a hospital, rehab centre, school board, etc., there are still possibilities for conflict of interest. Maybe someone approaches you, wants some supplemental private. That could be a perceived conflict of interest. It could be something from a patient record, or you might be uploading an organizational policy or something. Sarah, do you think that, oh, I didn't share my screen with you for that. There it is anyway. So I hope it was obvious there, 1.8 and 1.9. Anything else that you might add, Sarah, about that?
No, not for that. That's good.
Okay. So do you want to take over now, Sarah?
Okay, we're going to switch over. I will give some more information about the virtual peer assessment, and Alex will monitor the questions and keep talking to us. Okay, so we're now moving on to planning for the virtual interview. So the peer assessor and you have been connected. You've been assigned to a peer assessor. They will reach out to you, usually by email. If the email doesn't work, they also have your phone number, as long as you've uploaded all of that in the practice description. And you will confirm a mutual convenient virtual date for the interview. And ideally, you want to book, let's say, half a day. This is a trial this year. So we're saying, please at least book 3.5 hours time for the meeting. And between you, you will decide on a virtual platform that works for both of you. We are presuming that many of you have already had a lot of experience in this area because of what's happened in the last year. And so if you have a preference or the peer assessor can offer a choice, certainly discuss that together. If for any reason neither of you can come up with a preferred platform, then the peer assessor will contact the college. Julie, who is part of our team, Julie McFarland, will assist you with choosing a platform and make it available for the date and time that is agreed on. So once you've agreed on that, you've got the date, the time. You also want to get your records available from which you've submitted evidence, as well as records that you want to discuss for the clinical reasoning tool. Now, one other thing that will happen. So once the peer assessor has been assigned to you, they can review all your uploaded evidence. Sometimes the peer assessor may ask for some different or additional evidence for one or two of the indicators, and this is before the interview. And don't worry about that. That just means that maybe they don't fully understand, how it connects with the indicator. So you have time still to select that additional evidence before the interview. Then when it comes to the actual virtual interview, the peer assessor, obviously you'll introduce yourselves to each other, you'll go through any questions they may have about the SAT evidence. And a new part this year, as Alex did reference already, are the behavior-based questions. There's plenty of information in the guide and the appendix, The behavior-based questions are asked by the peer assessor to really determine how you behave or act in certain clinical situations. So there's actually a total of 8. They won't apply to all of you. 1 is audiologists only, and 1.5 is about support personnel. So if it was not applicable to you, that question won't be needed to be asked. But the other 6 should be for everybody. And Alex has given us some examples here. They could be about health and safety measures, seeking professional feedback, obtaining, documenting consent for all intervention, obtaining and documenting consent to collect, use, retain, and disclose personal health information, about communicating responsively to diverse backgrounds and experiences, and behaving in a professional manner. So, for example, how do you usually seek feedback from others when you need professional support? Or it could be, tell me about some approaches you've used to work effectively with others. So these are going to be open-ended questions. You do know which indicators they're being asked about. So you could probably prepare ahead as well and just have a little think, a think about, not a little think, a think about how you might respond to some of these questions. The peer assessor will review, as Alex already mentioned, this year's and last year's learning goals and CLACs. And another part of the virtual peer assessment is the clinical reasoning tool. So with the clinical reasoning tool, this is really an opportunity for you to talk about a patient. In fact, it's going to be 2 patients, and there are guided questions. Alex is showing us on the screen now exactly where the clinical reasoning tool is, gives instructions, what the peer assessors are looking for, and the questions are quite broad. There's some prompts there, maybe for you as well. And you are going to ideally choose 2 types of patient issues. So if you're in the school board, it might be a range. It could be fluency, could be voice, could be language, could be phonology. With audiology, it could be hearing assessment, it could be hearing prescription, a hearing aid prescription, it could be tinnitus, could be cerumen management. You're really looking for different areas. With adults, it could be aphasia, dysarthria, swallowing. So there's a whole range, trying to pick 2 patients with presenting different, that they present differently. Okay, are there any questions at this point, Alex? I'm just wondering if we should check in. We've talked about the behavior-based questions, the clinical reasoning tool, and what's happening in the virtual interview.
Excellent. We do just have a couple of very quick questions about evidence still.
Oh,
so,
yes.
But, I can actually answer it quite quickly. Do we need to submit, for example, an entire patient report, or just the section that demonstrates the evidence to show you're meeting that particular indicator and standard? So yes, it's just the section. So if it was a very lengthy report, in some cases you might be writing a 4 or 5 page report. However, there is just a couple of paragraphs that really speak to the indicator. You can just take, snip, take a photo, screenshot, etc., just of those areas. And then we do have another quick question, Sarah, about the actual day that you were talking about, and the actual virtual interview. Supposing you can't access a patient record, so you have uploaded evidence from the patient record, but supposing you're in a situation where you can't actually access that patient record, it could be that you're on a different site, you're not allowed to. So we was, our preference is that you can. If you can't, make sure you are very knowledgeable about that patient record, wouldn't you say, Sarah?
Yeah, I mean, obviously you, the registrant, and the peer assessor both can have access to the SAT and your uploaded
For
evidence. So
sure.
you're
For
still
sure.
always going to do that. That's not a problem. But yeah, I agree, Alex. If it's something, it would be helpful to have the background. And absolutely, for the clinical reasoning tool, please have those records in front of you because you can refer to them completely. The great thing about the clinical reasoning tool is this is your opportunity to actually talk about your rationale, your clinical reasoning, why
Yeah.
you chose to do what you did, why you
Yeah.
chose who you collaborated with, what recommended referrals you made. And it's really going sort of deeper in. Why have you done what you've done?
Yeah.
And knowing what you know now, what might you have done differently, reflecting on it as well. And this has become really, I think, a part of the peer assessment that has become valued because it's not just reviewing the records, it's really talking about who you're seeing, what you're doing with your patients, and why you're doing these things. So that's a good addition.
And actually, while we're on the clinical reasoning tool, and I would agree with you, Sarah, everything you've said, but one of the questions is, people have been using 5 records to upload the evidence. Do the clinical reasoning tool records have to be 2 of those 5?
No, I don't think so.
No,
No.
I would agree.
I mean, we're saying a minimum of 5. If you want to upload more than 5, 5 records evidence, that's fine. But absolutely, the clinical reasoning tool, ideally it would be someone current or just very recently discharged,
Yeah.
someone very fresh in your mind, someone who's interesting or being challenging in some way, that actually it's a thought-provoking exercise to actually discuss it. It would be good to do that. Yes.
Excellent. Okay.
All right.
Yes.
So continuing on then, one other part of the virtual peer assessment interview is something we now call virtual remediation. And it could be when you're having that conversation with the peer assessor that you both identify, it won't be just the peer assessor. We as peer assessors, we would say, before the peer assessor frequently that there might be one indicator, 1 or 2, where you do need work to meet the standard. So this is an opportunity where you and the peer assessor will discuss this together and you will generate a solution and agree on some evidence that will be required to show that you can meet that standard. Between you, you'll agree on a date within a short time frame. Ideally, I mean, some people I know did it within 1 or 2 days or within 1 week. Some may need a little bit extra time, but ideally it's a short-term frame, maybe 1 to 4 weeks, by which you can upload the new evidence. And you'll discuss it between you, what would be relevant. If it's over a standard and you need some more discussion, you can discuss that with the peer assessor. So that would be the other part of the interview if it's needed. Now, in the past, last year, I'd say maybe 7 did go through the virtual remediation. It was very successful. We've done surveys afterwards, and both you as registrants and the peer assessors have found it very satisfying that it was something that could be dealt with in the moment. So learning in the moment, there's definitely research saying how important that is. If there's a new idea or something you've not been aware of and you can deal with it then and there, that will make all the difference. Okay, so the interview is done. You've uploaded all your evidence. You have done your part. It is now in the peer assessor's hands to write a summary or a report, and I will explain both of these. The summary is exactly that. It's short and sweet. It is short because you have met all the professional standards and demonstrated clinical reasoning, and that summary reflects that you have met all the standards. If it's a report, you again shouldn't be surprised. It will go into more detail because it may need to explain the one or two or more professional standards that you did not meet to this point. In which case, the peer assessor describes which the indicator is. They explain why you haven't met that indicator, and that will be put into the report. Now, both the summaries and reports are reviewed by you. They get sent to you first. You have a chance to respond to that summary or report, if you wish, to the committee. Now, all of this information is anonymized, so the committee have no idea who you are or your place of work or your area. Well, they will know your area of practice because that is declared, but they're not revealing any additional personal information. And literally all they get is PA 13/21. And that's all they know. They do know if you're an audiologist or a speech pathologist as well. Yes. Okay, so that is the information that goes to the Quality Assurance Committee. When they receive that information, so the committee meetings happen, I'd say 6 to 8 weeks, so, you know, every 6 to 8 weeks. And usually it's scheduled. We always know, the peer assessors notify us when your virtual interview is happening. So say we know, I don't know, 15 are being done between April and May. There'll be a Quality Assurance Committee organized for the end of May. They'll review the summaries. And then at that point, a letter is sent to you, hopefully that you've successfully completed the process and congratulating you and acknowledging all the work that obviously this does involve. So Alex, anything that you would like to add at this point or any new questions?
There are no new questions just now. I think we've covered them.
Yeah.
I don't think there is anything. Did we talk about they have a chance to write a response?
Yeah, we did cover that. Yes.
But you
and
don't
really, yeah, you can contact us at the college, the staff, Alex, myself, Julie McFarland, who you don't see, but all that information is available in the guide. And obviously, when you're connected with your peer assessor, again, they are also a source of information at that point too. So.
And to Sarah was just outlining how this is an anonymous process. So, you know, contact us anytime and just say, look, I want this between, you know, to remain private, but you know, I'm concerned maybe my peer assessor hasn't contacted me yet, or something like that, you know, or you might have some questions about your evidence or something, you know, you can just contact Sarah or I at any time. You know, we are definitely here for you. But otherwise, I think if there are no more questions, I'm just going down. Really pleased that you were able to join us today. I think these webinars help, you know, to show you documents, talk you through processes. So if there is, okay, what's the latest date we should expect to hear from our peer assessor? Well, we will, that's a good question, actually. We will be letting you know who your peer assessor is. Don't forget, everybody has a chance to veto, so that does take a week or two. And then after that, we contact the peer, when, you know, everyone's had a chance to veto, then we will contact the peer assessors. So we won't be contacting the peer assessors for at least 2 weeks after we've let you know who your peer assessor is, because we've got to get through the veto process. So then you should be hearing, I would say, Sarah, would you say it would be reasonable within 3 to 4 weeks?
Yeah, so yes, yeah, should be
However,
good.
I am going to give the caveat is if you're asking for an early peer assessment for example, in April, I know a couple have asked for April peer assessments. We will be letting the peer assessors know that an early one has been requested, and then they would contact you quicker.
Yes, yes, the peer assessors are usually very responsive that way. We usually give them a heads up saying that if you've let us know as well. Yeah. The other thing is, if you prefer it in French, let us know.
Yes. The whole process.
Yeah.
So yes, we have bilingual peer assessors in speech pathology and audiology. Excellent. Yeah. So I think, Sarah, we'll maybe say goodbye. There are still no questions, but we're always open for questions via email. And just to say, hope you have a fantastic day. And my stomach's rumbling. So I am looking forward to my lunch just now. Sarah, do you want to say or add anything?
No, get in touch with us if we've not answered your questions. We are here for you.
Excellent.
Have a great day.
Bye.
Goodbye.